Hey guys, it's Lori, pharmacist. Just gonna jump on here for a few minutes and discuss the Pfizer vaccine ingredients. It's kind of entertaining. I was just looking at this, I don't know what I'm like, the CHI Memorial page or whatever, the hospital page. You know, they had put out this video yesterday on Tiffany. Hospital shares update. Said on Monday that a nurse who fainted after receiving the COVID-19 vaccine is doing well. And then they put this video up, and it has a person who looks very similar. Good morning, guys. Hey, Nana, how are you? Have you been following this story? It's so crazy. But it's clearly not her. So I'm gonna click on that video in a minute. But what also came up, this was 14 hours ago, WCVC's Josh Rowe says, we asked CHI Memorial if Dover would be available for an interview today. The hospital says she is asking for privacy. Over the weekend, the hospital tweeted that Dover appreciates the concern shown for her. Dover did answer questions minutes after her fall last week. And then, of course, we have not seen hide nor hair of her since, even though the hospital's made this video to make it look like she's alive and well living in Chattanooga, Tennessee. So, what hospital shares video? I was going to click on this because, you know, I don't know. I just don't get the whole privacy thing if she's doing fine. Let's see. TV saying we got to convince the people to get the vax. Oh, yeah. Thank you for doing these. Oh, you're welcome, Jody. I heard family say says she passed away. You know, there was one of my Facebook friends sent me an Instagram page. I think it says in memory of Tiffany Dover. I posted it. People started questioning, is this really true? And the truth is, I don't really know. I don't know who it is. It said they've obviously got personal pictures of hers, which, I mean, maybe you can download it from one Instagram account to another. All vaccines are rushed, deadly, dangerous, and unethical. Vaccines have never eradicated anything. They lie. You nailed it, Martina. But whether she's dead, which I pray to God she's not, or if she's just been seriously injured and can't speak. But they're clearly faking this, and it's just such a huge cover-up. And yet this is so typical of what the pharmaceutical industry does, and this is what I want. You know, this whole COVID thing, this whole vaccine thing is really putting it on display, because this behavior has been going on for decades upon decades over drugs and vaccines. So they signed contract to not speak up. Ooh, can you get me? Who's saying that? Martinez, Sabrina. Okay, sorry, your last name's Martinez, I guess. Can we find a copy of whatever it is they're signing? I wouldn't doubt it for a minute. There's no telling what they're making these people sign to say, if something goes wrong, you know, you got to keep it on the DL because this is experimental. It's insanity. And I was texting my daughter this morning. She knows a nurse personally who just got the vaccine and is like, I'll let you know how it goes, you know, and I hope she fares better than Tiffany for sure. But I'm just praying for God to show us the truth on this. When you do a trial, you sign a a trial. Okay. I did before without knowing. Okay. Yeah, I did a drug trial years and years ago when I was in pharmacy school. It was for an inhaler back when my asthma was still bothering me and I didn't realize what was causing it and that kind of thing. And I don't remember what I signed. I have no clue, but I got paid $1,000 and they didn't have to do any blood draws. All I had to do was inhale something. So I felt like that was pretty safe. Tara, this woman is interesting to listen to. Oh, maybe you're talking to a friend. My daughter was injured. Pediatrician said to give her the same vaccine or she could not be a patient. Well, that was certainly a caring, loving, do no harm physician there, wasn't it? Which, speaking of that, somebody sent me a TikTok video of a nurse. So this came through Messenger, talking about the nurse's oath, which is pretty interesting, and I want to look at that because it has something to do with that, with not administering drugs that or think might cause harm to your patient. When I went through chemo trial, they said I signed a contract that vanquished my right to sue or complain. Wow, that is a mind blower. They almost killed me. Well, I'm glad they didn't, by the grace of God. Dang. So, yeah, you said it. Fire that doctor. So anyway, I mean, I was thinking, and I don't know, let's just like put our brains together. Obviously, there's already a huge fallout of adverse reactions from this vaccine. We don't know how many deaths because they're going to do all they can to cover it. Somebody sent me something yesterday. I get so many messages, I lose track, about, according to the FDA, if there's more than 10 deaths from a vaccine, and I don't know what in time frame they're talking about, but they have to pull it. So if anybody knows anything about that, I'd like some more research. I'll try to do research myself. Exactly. But unfortunately, they're convinced that we're the slaves and they're the owners, right? Because the doctor tells you what to do. They look down on you if you don't do it. They kick you out of their practice if you don't do it. I mean, I've had this happen with a woman I've been counseling since like September who had a horrible drug reaction and hepatitis, acute autoimmune hepatitis, which was pharmaceutically induced, okay? And like one doctor, because she wouldn't take one of the drugs he prescribed because of all the side effects, he didn't want anything to do with her anymore. It's crazy. And yet all they have in their toolbox is drugs. Like they're not going to offer you how to eat better, or change your lifestyle habits or anything like that. I'm going to read what's in Pfizer COVID-19 vaccine. This is funny, okay? All right, so the first thing they list is mRNA. This is off health.com, whatever. Then it says lipids. Let's see, my daughter got whooping cough 3 times each after the whooping cough. Yeah, the whooping cough vaccine is like worthless. If you look at the surveillance the CDC does yearly on the whooping cough, because they actually keep track of cases in the U.S., the highest incidence of whooping cough is in the fully vaccinated. It's, hello, but got to get that whooping cough vaccine. I don't think I've ever had whooping cough. Okay, so we got mRNA. Then next thing is lipids. Okay, lipids, that's fats. Here we go. Including 4-hydroxybutyl azanadiol bis hexane -6,1-diol bis 2-hexyl decanoate, 2 polyethylene glycol -2000 capital N, capital N ditetradecylamide, 1,2 disterol SN glycero -3 phosphocholine, and cholesterol. That is literally all one thing. Like together. Like they're not broken up. I mean, yeah, that's mind-blowing. I mean, who wouldn't want that injected into them? Makes sense to me. Then it goes on. Potassium chloride, which, I mean, obviously it's a very small quantity, but it does have the potential to stop the heart in certain dosages. Monobasic potassium phosphate, sodium chloride, dibasic sodium phosphate, dihydrate, and sucrose. A little bit of sugar there. Yum. Just a spoonful of sugar. All right. The mRNA we've already covered, but the lipids are also a crucial element. The lipids, which are fats, are very important because they form a little spherical shell around that mRNA, William Schaefer, MD, an infectious disease specialist, blah, blah, blah. All right, so they got to have those lipids in there. Well, the polyethylene glycol, which I think I misspoke yesterday, and I just want to apologize. I think I said on the video that polyethylene glycol has been used in vaccines before. When I really went into research today, it actually says it's never been used in approved vaccines. Well, silly me. But polyethylene glycol is not antifreeze. Ethylene glycol is antifreeze. Polyethylene glycol is actually used in, cosmetics, and derivatives are widely used in cosmetics as surfactants, cleansing agents, emulsifiers, skin conditioners, and humectants. All right, so they've never been used in an approved vaccine, but we're gonna do this with an experimental vaccine, and we're gonna test it out on the population because Pfizer's gonna sell as many guinea pigs who are gonna be willing to buy it, right? And they have no liability. So I just think that's absolutely brilliant. And that these people that are signing on for this have no clue. And then there's also the great statement. Let me see. I firmly believe vaccines caused my severe depression that got worse in college. I wouldn't doubt it. I guess, I don't know if I've told you guys, but took me to my 50s to realize, and all this vaccine stuff, that I'm vaccine damaged. Because I presented with asthma as a 4-year-old. I was not born with asthma. It came out of the clear blue. Now, I was given, of course, smallpox back then, DPT, and polio. Thank God I survived. I was not really a breastfed baby. My mom only breastfed me for 6 weeks because she didn't know any better. Then she put me on cow's milk. Well, what I'm guessing now is I've realized I'm allergic to cow's milk, especially in yogurt and that kind of thing. It triggers asthma. And I'm really thinking now, I'm starting to think I'm allergic to peanut butter. Not like anaphylactic wise, but I realize I start getting like chest congestion and stuff like that when I eat peanut butter. So, and I just believe it's probably induced by vaccines. My little granddaughter has not been vaccinated, and she's not allergic to anything. I mean, she's just doing amazing. Did anyone hear the rumors that many nurses are being sent home sick after getting the COVID vaccine? I mean, here's the thing. The CDC, let me see if I have this pulled up, has put out guidelines, and there was something I posted yesterday, I think, about the FDA. They're realizing this vaccine is causing a lot of issues with a lot of people. And I just would like to have, first of all, if any of you out there hear of anybody with a vaccine react to this vaccine, please either email me at thewisepharmacist@gmail.com or send me something through Messenger, because I want to track these things and I want to make them as public as we can. And really, I'd like to get some people that really have huge followings, like, I don't know, Alex Jones, Spiros, like somehow loop in with them, which, by the way, I've had a guy contact me about being on his radio show. I have a phone call set with him about 5 o'clock today, and I'll let you know more about that. It's something that came through last night. So, but they're patriots. It's a health freedom radio thing. And, we just need to promote all these people that already have huge followings, and even little people like me that don't have that huge of a following, but are speaking the truth, because the more people out there, the more it's going to spread and the truth is going to be known. So, and like I've said before, as far as I know, I'm the only pharmacist speaking out. I know a lot of pharmacists that are awake or partially awake. They know something's up, but they're employed, right? And by a pharmacy. And if they say anything, it's going to be the axe. So I understand that, It's been a tough year for me, but I've been able to walk in my integrity and not have to look over my shoulder, and that is like the most liberating feeling. So, and I took an oath as a pharmacist to do is in your best interest. I am your servant, and you come first. Not even my flipping salary, okay? It's part of being a healthcare provider. So, and I believe if you do the right thing, you're going to get blessed in it anyway. So I'll take that. I've been following you since you started speaking truth. I love you. Oh, thank you, Cassandra. I appreciate that, sweetie. I appreciate that so much. So anyway, yeah, it's polyethylene glycol. But when you read all, these words this long, chemicals that are being injected into you, this is totally experimental. I mean, there's no telling what is causing these reactions. And we still have, this is just right after they get the vaccine. We have no idea long term, right? No idea at all. So let's just continue to pray for freedom. Pray for the truth to be revealed. I want to know the truth about this Tiffany girl. So I think we got to stay on this. Some people are like, oh, they're trying to distract you. Distract me from what? It's not like I'm not reading any other articles or thinking about anything else. But no, I know how pharma likes to brush things under the rug and hope you forget about it. That's their MO. And, I'll tell you this. A friend of mine who's a nurse in Tennessee messaged me today, and she said she knows a nurse on staff at this hospital who has no clue anything about this feigning thing with this nurse. I think that's what she was saying. That's right. Are in full informed consent and advocate for the people. Amen. Anyway, she's put this nurse on it that works at the hospital to find out more about what's going on. Okay, that's A. Somebody else suggested about coming up with a people-funded, investigator, to follow up and find out what's going on with this Tiffany girl. I don't really know how that works, because when you're dealing with the medical profession and HIPAA, it's so interesting how HIPAA comes down. I think that was all Hillary Clinton, and it sounded so great, right? The privacy and the this and that. And that's fine. But isn't it funny how that Privacy Act has been, it's a double-edged sword, because when something does go wrong like this with this vaccine, this girl, the public doesn't have a right to know. We don't have a right to know what these people that, shot up, mass shootings, like what kind of drugs they were on. We don't have a right to know any of that. So it basically shields the pharmaceutical industry from people really knowing the truth and being able to track what's going on with all these drugs. Oh, shoot, I realized I forgot to put my phone on do not disturb. But anyway, so I don't really have anything much else to say on this live. Oh, there's a lady. You're a pharmacist, and I own a Parthurist, but I don't know where to start. I'm a nurse. Okay. Girl sending me something through Messenger. I just, I feel sorry for the guinea pigs. I feel sorry for the gullible. I pray whatever happened to this Tammy girl, that the truth comes out. I pray that the people that are, in the hospital that know about this, that it helps to wake them up, Regarding HIPAA and privacy, client alert, compliance with federal patient confidentiality laws. Right. Oh, thank you, Nana. I will look at that when I get off of here. I'm actually I've got to be at work at noon. It's 11:05, so I've still got to feed my little doggies before I go. But, all right, you guys just stay in touch. I want to follow up on any and every person that's had a vaccine reaction as best we can. I don't know if there's a way to form some kind of a group, a coalition, that anybody that would be willing to talk about it. But again, I guess they sign a waiver saying they're not going to speak up. So if there's enough injury and death, somebody's got to be willing to speak up, or at least family members, because the family members didn't sign anything, okay? Just that person. And if that person turns up flat on their back in a hospital bed, or worst case scenario, dead, it seems like the family members would be willing to say, well, this is what happened, and this is what we know. What'd she say? I'm not sure what you're asking. COVID Coalition Truthers. Is that an actual group, or is that a group we're going to start, Karen? Yeah, I was thinking something to do with vaccine injuries from COVID-19, vaccine injury and deaths from COVID-19. Something that's real specific as far as we're just dealing with people or family members who have had people that got this vaccine and they were injured or killed or whatever their experience was. No, we should start it. I'm in. I'm completely in. You know, I mean, really, when you see all the things that are going on with the election and just the way the patriots are standing up and the Christians are taking a stand and we're not laying down anymore, man, it just gives me cold chills. It really does. I will have to view this video from the beginning. Okay, Chantel, yeah. We definitely need it. All right, Karen, let me get your name. I'm going to write your name down here. If you want, I'll post a link in the description where I'm reading from these blessed ingredients of the Pfizer vaccine. Hold on, I want to get your name. Karen, P-A-V, how do you, P-A-V-I-L-O-N-I-S. All right, more power, you know? We're just going to keep, I call it a dog with a bone. You know, I'm not letting go. How do we view this video from the beginning? When I share it, when I get done here, I'll share it and then you'll be able to go back and view it. And I'm also posting these videos on YouTube if you want to become a YouTube subscriber. So far, they haven't kicked me off. I try to word things in such a way that I'm not stating, thus saith the Lord, when I state something, because it never is. Everything really is our opinion until, but you know, the proof is in the pudding, as they say. So, what do? Praying God's blessing on you and your voice. Praying for all those affected by the COVID and the vaccine. Thank you. Thank you so much, Ronnie. I appreciate that. Okay, I will post the ingredients link page for sure. And I posted already yesterday about where the FDA is talking about, was it the FDA? Whatever, something came out in Science magazine. I actually sent it to this doctor friend of mine who, that's another interesting story. The doctor I'd been arguing about with last year, an infectious disease doctor, all back and forth about vaccines, and he's all hail vaccines. He ain't so sure about this one. Yeah, it's even awakened him. Okay, it was Science Mag. Suspicions grow that nanoparticles, that would be your lipids, in Pfizer's COVID-19 vaccine trigger rare allergic reactions. I mean, that's a guinea pig right there, you know? Did any of them read the ingredients? Did anyone have a freaking clue? No. Yeah. Pharma knows all. Here we go. Oh, wait, this is Children's Health Defense. FDA investigates allergic reactions to Pfizer COVID vaccine after more healthcare workers hospitalized. So I think it's across the board. And then I did post, a woman had sent me, and I think people thought it was my best friend. I just kind of quoted what she said, but I took out some part of her quote because I didn't want anybody to know where she was from or any details, because I would never, if you contact me and we post about this, make anybody's identity known. I mean, I do respect your privacy, and I would never do that. The whole point is to make people aware that how many people, or give them an idea that the injuries from this vaccine are far and wide, and it's not just this one person way over here and no more. You know what I'm saying? I don't need to read the ingredients to know I'm not going to be a sheeple. I'm in the amen corner there, sis. But it's fun to me to read the ingredients, because I think, where in their brains, that they're so intelligent and they're such experts, did they think that injecting this stuff was such a great idea? You know? But they think they know everything. They defy the existence of God. They know more than God. You know, the immune system that God gave us, even though this virus has a 99+% recovery rate, unless you're over 70, and then it's 94.6+% recover. That's your immune system doing its job right there. Hello, the one that was instilled in you naturally. But we're going to come up with a vaccine that's experimental in more ways than one, and we're going to cross our fingers. Why? I mean, all I see is the money. That's all I see. I don't see any good reason with the recovery rate statistically of this virus. But guinea pigs will be guinea pigs. Science is to them their religion. Yes, you are exactly right. We need to post links to side effects people are receiving. That is a great suggestion. Will you message me? Sounds like you've got some great ideas. You're probably more experienced at starting groups than I am. I don't think I've ever started a group. Probably should have, but never have. So, I can speak out. I can do the research. Yes, pharmacopoeia. You're exactly right, Karen. Sorcery, witchcraft, spells, good stuff. How do you feel about ivermectin? I would definitely try ivermectin. I personally wouldn't, because I'm just one of those health nuts that believes in my immune system. But as a recommendation as a pharmacist, as far as safety and what we know about ivermectin, absolutely. I would, if that would make you feel better, they're saying it's more of a prophylactic type of thing. But it is overall considered very safe. So I feel good about ivermectin. That's what I have to say about it. Yeah. I also feel really good about hydroxychloroquine, but we won't go there because we don't want this video taken down. But just saying, it's been dispensed for years for other things, and the safety profile is out there. Why would we use new drugs where we don't know the safety profile when we could use older drugs potentially that we know are probably not going to harm anybody? Well, because there's no money in old drugs. Yeah. Climate change need to wipe half the population, better away than nuclear weapons. I don't even really believe in the whole climate change. This is one of the coldest winters right now in Florida that we've had. I say because we normally don't get freezing weather until January, and we'll be on like our 4th or 5th freeze come next week. It's supposed to get down to like 28 2 nights in a row. So, but the last 2 winters before this, it hardly froze. I mean, it maybe got down to 32, 33, but they got it after symptoms, and Facebook took the ivermectin info down too. Oh, of course they did. Of course they did. They're aligned with the narrative, which is the pharmaceutical industry. Is quinine the same as hydroxychloroquine? It is a derivative, not really a derivative. It's more like an improved version. It has less side effects. They added a hydroxy group, okay? So there's quinine, chloroquine, and then hydroxychloroquine. They're interrelated though, and they do have, they have the anti-malarial, which has to do with the antiviral type stuff going on that they work in, yeah. But anyway. All right, guys, it's 11:15. I got to jump off here. Just keep in touch, and I'll be jumping on tomorrow for a follow-up of whatever's going on. If there's anything you want me to discuss. I've been asked to discuss Lyme disease, which maybe I'll be able to do some research on that tonight when I get home and do a little bit on that. But anyway, I'm here for you guys. Any questions? My email, again, is thewisepharmacist@gmail.com. My website is thewisepharmacist.com. You guys have a great day, and we'll talk soon. All right, bye.